Hello, everyone. It's Monday, March 22nd, and I don't know how in the world you can say you're very happy about this, but when I look down and we've had 12 deaths versus looking down and having 80 or 85 or whatever it may be, 12 surely looks a lot better. And but I don't want us to lose focus. With losing 12 great West Virginians is tragic beyond belief, and so we want to keep these people really close to us from the standpoint of all their loved ones do not need to feel alone, and all these people should be appreciated for all that they've given. And I hate it like crazy that this terrible killer pandemic is still taking lives in West Virginia, but we're getting better. The 2,600th death, and I want to make sure of this. I thought we had 2,600 before we started today. So that's correct, isn't it?
We're starting at 2,600.
We had 2,599 before we started today. I thought Friday we had 2,600.
Okay.
I'm going to go with 2,601 here, okay? Because I want it to be right, and y'all check it, and then I'll tell you what. Y'all check it real fast, and I'm going to go to something else here. I just think these people deserve so much respect, and I don't want to mess something up there. Our 276, we have 276 new positive cases in the last 24 hours. We didn't test a lot. We came out with a 5.21 daily positivity. Our cumulative positive continues to fall. It's at 5.29 now. Here's something that we got to watch. Our active cases have increased. We were under, I think we were under 5,200. We're at 5,600 now. Our recovered cases are 129,892. Our number of hospitalized are 198. We're right at the 200 level again, and our patients in the ICU unit are 67. We have one county that's red, that's Jefferson County. We got to really watch there. Now, let me go back, and I'm a numbers guy, and I was right on the number, but we did have 2,600 on Friday, so I'll start now. Our 2,601st death in West Virginia is an 84-year-old female from Putnam County. Our 2,602nd death is a 71-year-old female from Kanawha County. Our 2,603rd death is an 84-year-old male from Berkeley County. Our 2,604th death is a 92-year-old male from Wood County. Our 2,605th death is a 71-year-old male from Kanawha County. Our 2,606th death is a 73-year-old male from Boone County. Our 2,607th death is an 86-year-old male from Cabell County. Our 2,608th death is a 68-year-old male from Putnam County. Our 2,609th death is an 81-year-old male from Kanawha County. Our 2,610th death is a 65-year-old female from Kanawha County. Our 2,611th death is a 71-year-old male from Putnam County. And our 2,612th death in West Virginia is a 64-year-old male from Upshur County. Please don't let them become a number. Please keep them in your prayers. These people have given so much wisdom, and please just keep them close to your heart. A reminder again, as I've done many, many times, if you're 65 years of age and older and you get some level of symptom, headache, tired, cold, fever, please go get tested. We can give you the antibodies and save your life if we can catch this early enough without any problem whatsoever. 12 more West Virginians right here. Absolutely, we don't want you to be one of these. So go get tested. It's free, it's painless, and it just takes a minute, and they're all over the state. Okay. Today, I am announcing that we are officially opening up our vaccine eligibility to all West Virginians over 16 years of age beginning this week. So beginning right now, and Brian, you're wrong. Clay wants to start it right now, okay? Beginning right now. If you're 16 years of age and older and you want to get vaccinated, you get into one of our clinics or whatever it may be, and we'll get it done. So as we continue to lead the nation with our vaccine distribution, we do not want to let take our foot off the gas. I encourage all West Virginians to take advantage of this opportunity and get vaccinated. We're going to continue prioritizing all those 65 years of age and older. But at the same time, we have got to get more and more and more West Virginians, and now's our time. Now's our time. Let's go, West Virginia, and absolutely let's get everybody in this state vaccinated. That ought to be our goal. I know we're not going to be able to obtain that goal, but we're going to absolutely be close. And that's what we need to continue to do. From the standpoint of our vaccine distribution update, we are now at 96.2% of the total administration rate of first and second round doses. Our goal is always 100%. We have now vaccinated in West Virginia 709,830 doses that have been given to great West Virginians. Of that, 441,902 have gone as first doses, and 267,927 are second round doses. Our Saving Our Wisdom clinics are up and going, and all across our state. So far, there has been, get this number, 221,739 individuals in the 65 and older population in West Virginia who have chosen to get vaccinated. And 150,000 of them have been fully vaccinated. And that means when you add up the doses from the Veterans Administration and from the Federal Pharmacy Partnership with Walgreens, we're at 70% of our 65 and older population that has been vaccinated. Now I want to stop right there. I don't have any idea what other states are at, but I can't imagine that they're at 70% of our 65-year-olds or older. Now, we had a goal, and the goal was put out, by our medical experts and everything, because they know obtaining 75% of that population was a lofty goal. And I said, no. We've got to be better than that. We really want to set our goal at 85%. The goal really ought to be 100. But I know some are just going to be too stubborn or convinced of the really propaganda that is out there, and that they're going to refuse to take this shot. That's a real mistake. That's a real mistake, people. I mean, if you'll just listen to all that goes on all over the place and everything, without any question, if you're 65 years of age and older and you get this, and people get it, people are continuing to get it. In fact, just today, over the weekend, there was 276 new positive cases in West Virginia. Now, people get it. If you would be one that gets this and you'd happen to be 75 or whatever your age may be, over 65, you're in real trouble. That's all there is to it. You're in real trouble. Now, all the data, everything tells us right to our face, everything tells us that one thing: if you get vaccinated, really and truly, you could still, very unlikely, but you could still possibly get COVID. Now let's just take worst case scenario. All the data says if you're vaccinated and you would get it, the likelihood of being hospitalized is really low. And the likelihood of death is almost zero. Now, how in the world could you not get vaccinated? No matter what anybody's telling you, no matter what, and I know too, that if you're 70 years old, 80 years old, 65 years old, Me. And I get this, and I've not been vaccinated, I'm in real trouble. You are too. Real trouble. Now, we need this number to fly past 80%, fly past 85%, and the only way we're going to get there is you quit listening to this garbage that people may feed you about this vaccine. And absolutely, if you're up hoo-hoo holler or wherever it may be, and you can't get to where, you want to take the shot, but you can't get there some way, somehow, you've got to have somebody, somewhere notify us, and we'll come to you. We'll absolutely come to you. We want this number to go right on past 80, past 85. We want to try every way we possibly can to save your life. Now, as I understand it, in West Virginia, we've got a little more than 350,000, I think that's the number. It may not be quite that many, 65 and older people. Now, we know this disease, some disease target children, some disease target the elderly. In this situation, we have vaccinated 221,739 individuals, and no telling how many lives have been saved. But really, at the end of the day, if we can save one, we've really done something phenomenal. That's all there is to it. Now, a lot of people push back on me on this. There was a time not long ago that we had 3 people, and we couldn't absolutely identify for sure where they were. But they'd gone into mines, and they'd gone into these abandoned mines, probably to do something that wasn't very good, maybe steal copper or whatever it may be. And we are almost right on the verge of saying, well, if they're in there, they're probably dead, and they may not even be in there. And I wouldn't give up. And our rescuers wouldn't give up. And we went back and we found them. We found them alive. And absolutely, what I am saying to you is when you have the opportunity to save a life and you're a neighbor or whatever to someone that hadn't had their vaccine, please help us. Please help us get them across the finish line. We tripled to triple again, did we not, on our Saving Our Wisdom to make sure that we are getting all West Virginians over 65. I've directed our joint interagency task force to make certain that we are clearing out all the pre-registration list and we do not miss anyone. They are noting, who is not answering the phones, and we are trying to get in touch with them in every way. These names are being sent to the counties so that they can schedule these West Virginians as soon as possible. And we are also sending more people to our call center so that the operators can best assist with the scheduling. Our vaccine scheduling system is out there. We want anyone over 16 to register. Please do that. The vaccine info hotline is out there. The vaccine reminders, that over and over there's been I just said it a minute ago, but tens and tens of thousands of trials and people and everybody has demonstrated that this vaccine is very effective and very, very safe. All the stuff's up on, how, our places to get tested. It's free. All the maps are up there. We thank Fruth. We thank Walgreens for all the great work they've done. We still only have 1 outbreak in our long-term care facilities. It's phenomenal. Watch out, churches. Now you're up to 7 active outbreaks reported in 5 counties. That's Fayette, Webster, Monongahela, Raleigh, and Nicholas County. And all I'm saying by watch out is please don't let this killer absolutely jump on us in the most sacred places of all, our churches. So absolutely just protect yourself. Pew in between you, wear your mask, absolute social distance. We're on the home stretch here, West Virginia. Let's get across the finish line together. We have 31 inmate cases and 3 staff in our corrections. They continue to do a phenomenal job. We've got 25 at North Central, 3 at South Central, and 2 at Western. They've done phenomenal work. That's really good. All of our guidelines are up there. I tell you over and over, wear your mask. And absolutely, if you have the opportunity to give blood, We want you to give blood. And I'm hurrying along today because there is so much going on and everything. And and we've got some other things that we really need to tend to, but I want to be here in front of you and surely want to pay all the respect in the world to these great West Virginians we've lost. But thank you so much.
All right, thank you, Governor. Let's now go to Dr. Ayn Amjad, our State Health Officer.
Good morning. I do want to mention a couple things about COVID-19 cases and quarantine. We did get a lot of questions this past weekend. So every COVID-19 case that we come across, and if you've been exposed, does go through a vigorous interviewing process by the health department and our interviewing team with standardized questions. We do need to get a list of your contacts, which is very important. One thing that we do need people to understand is when someone is infectious or having symptoms, we do have to go back in time approximately 2 days of when your symptoms start. So that is one thing that we do ask someone who comes down with COVID-19. So for example, if I have any symptoms today, Monday, we do want to know your contacts 2 days prior. So your contacts say, Saturday and Sunday would be important for me if I started to show symptoms today on Monday. A close contact is also someone who's been within 6 feet of you for 15 minutes or greater within a 24-hour period or an entire day. So that is something that we also identify as close contacts, with or without a mask that you're wearing at that time. Also something to remember is CDC has set out new guidelines, and while they do recommend 14 days as a recommendation for quarantine, we have shortened the recommendations, which is also CDC recommended, to quarantine for 7 days. 5 days is also acceptable with a negative test. So those are also up on our website. If there's any questions, our health departments are also following those guidelines. We've also gotten a lot of questions about if you've been vaccinated with COVID-19. You have to be fully vaccinated with the full 2-dose series if you've gotten, Moderna or Pfizer, and that is the full doses that you've received, and then 2 weeks after that to be considered in that safety zone per se. So if you've been fully vaccinated with 2 doses and you're 2 weeks past that, and you've been around someone with COVID-19, and if you are not having any symptoms, then you do not need to quarantine. So we've gotten a lot of questions this past weekend. If there are any more, we'd be happy to take them. But that's all I have for now, Jordan. Thank you.
All right, thank you, Dr. Amjad. Governor, back to you for a moment.
Okay, we have another announcement and everything that we didn't get, right here, but I want to tell you this because a lot of people have called and asked about this in regard to our fairs and festivals. As we get closer and closer and closer to some level of normalcy, I am so hopeful that we're going to be able to have our fairs and festivals and do a lot of good stuff and everything, and try to get back to that normalcy as fast as we possibly can. Now, to be able to do that, we really need you to really take advantage of getting these vaccines, because the vaccines are our ticket. I told you a long time ago, we're trying to just wait and get ourselves to the bridge. We're trying to bridge ourselves to the vaccine. Well, we're getting there. So as of today, I am announcing that all fairs, festivals, and similar events will be allowed to resume on May 1st. And so, we'll issue updated safety guidelines this week, and I expect all these events to continue following the safety guidelines in order to keep West Virginians safe if they choose to attend these events. But these events are part of our fiber. We want them to go on, and so, I'm giving you plenty of notice and everything, but, unless there's a real backslide here somewhere and everything, we want to have those fairs and festivals. And so May 1st, go in every way. Thank you.
All right, thank you, Governor. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young from WV News. Governor, I know at the end of last week you called for an investigation into our previously unreported COVID deaths, and I was wondering if you could give us a little bit more information about that. Who is actually going to be conducting the investigation? Is there a time frame for when it will be completed? And what's the result going to be? Is this going to result in like a publicly available report? What do you hope the outcome is? Thank you.
Okay, Charles, here's what we got, we've been told that before we go out and we start telling about the progress and everything, we need to complete that. I've been told we'll complete that this week, and from the Department of Public Safety, which basically is conducting an investigation, and I want them to turn over every stone and be certain, absolutely certain of what they report. And I want it 100% transparent and everything in every way. And Charles, if you'll just give me, I think they're telling us it's going to take this week to complete their work. And the Department of Homeland Security is also conducting the investigation. So we'll know who the bad actors are, and if they just need significant encouragement, or if there's something even worse than that.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking the question. Governor, congratulations on the vaccination rate for West Virginians 65 and older. As you know, I've been asking about that for the past couple of weeks, mainly because of the system itself concerning Everbridge and the seniors that followed the rules and have been waiting for a long time without hearing anything, not about the overall vaccination rate, which I think West Virginia has done a tremendous job, and you and everyone on the panel and all the volunteers, healthcare workers, and National Guard folks should be congratulated. So the questions are in no means meant to criticize the raw numbers. I'm very proud of my home state and how it's done. It's just to make sure we don't forget the most vulnerable and frankly, sometimes a population that gets scared and fearful. And those were the messages that were being communicated to me that I wanted to make sure I could get to you, that they were scared and confused and feeling very helpless. And it was heartbreaking. So the fact that you've opened up more people on the phone lines to contact them is fantastic. I'm wondering if you could go into detail, if you have any available today, on those 3 fixed site clinics you said we're going to be opening throughout the state, where those locations might be and when we might expect to see those opening up. Thank you.
Okay, Kenny, first of all, let me just say this. I think you do a fabulous job. And by just constantly coming back to us with the feedback and everything that you did, you and yourself saved lives. That's all there is to it. Because you pushed us, and then I pushed our people, and we changed things. And that's what we do. As far as detail about the 3 big clinics that are around the state, are going to go on around the state. General Hoyer's not with us today, and he's going to have more information than any of us and everything. And I'll make sure that someone gets back to you in that regard. I think maybe is Secretary Crouch, is he with us? Maybe he could bring you up just a little bit, more on that than I can. But really and true, Kenny, I appreciate what you do and appreciate what you do every day. But anyway, Secretary Crouch, maybe you could add just a little bit.
Yes, Governor, thank you. And yes, Kenny, we're still focused on that population, and we've been focused on that population. The governor directed us to target that population with everything we've done. And with regard to Everbridge, let me just say again that the initial effort there was to take all of those calls off the local health departments, thousands and thousands of calls, and we have over 400 and some thousand now on Everbridge. But the issue became a little problematic when the federal government started pushing vaccine to pharmacies and to FQHCs, clinics, where they don't use Everbridge. So we have doubled back. As I mentioned last week, we've contacted all of the African Americans age 65 and over. We got through that list. Part of the issue here, and the governor mentioned this, we have to call many, many times to some folks, 3 and 4 and 5 times before we would connect, and that's understandable. People are out and about now. So, but we have all of those individuals, African American population age 65 and over, out to the clinics to be scheduled. In addition, all of the clinics in the state contacted those on those 80 and over on the list last week. This week we're tackling 70 and over, so that everybody on the list, and then we'll tackle 65 and over, that we get them into a clinic as quickly as we can. The 3 clinics for 65 and over, Charleston is one of those, Morgantown is the other, and I do not, Kenny, have the third one right now. I will get that for you, and we'll make that available on the website so that everyone knows where those are, where the third one is. So the effort there is to make sure everybody 65 and over, whether you're on the list or not, come into the clinic and get vaccinated. As the governor said, we're on the home stretch here. We have to have everybody come out. Everybody needs to get that shot in the arm. So, so stay safe. Thank you for the question.
All right, thank you, Kenny. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel and fellow reporters. I want to direct this toward Dr. Amjad. We've heard anecdotally that the flu season has not been as bad this year as it has been in past years. How does the flu season this year compare to previous years as far as total cases and even fatalities? Thank you.
Doc, please go.
Yes, Governor. Paul, you're right. We have not seen a lot of cases in our state, and even a lot of hospitalizations. We can get you actually numbers later on today from our data team, but I think because of the mask wearing, the vigorous hand washing, and social distancing, that has played a great factor into it. But if you need actual numbers, we can produce those and give those to you later. But we do believe what we've seen this year with those 3 mitigation efforts, that it's played a big role. So that's real good news. And even actual for deaths, we have not seen a high number of cases. So we can get those actual numbers to you later. Thank you.
Come back to me just 1 second, Jordan. You know, I got to say this, Paul. You know, I'm a Christian through and through. I truly believe these words, that the Lord will not put on us more than we can handle. And really, you know, that may in itself, or I would even say that is in itself, maybe why we haven't had more than we can handle with the flu and this terrible killer pandemic. But it's been tough enough, and a lot of people have had courage beyond belief, and the job they've done is so good, so good. So that's my feelings. That's my answer.
All right, thank you, Paul. Next to Haley Kosick with Next Star Media.
Good morning, everyone. I have a question actually for one of our fellow reporters who's working on a story in regards to the confusion since Walgreens has gone independent with their COVID vaccination system. So how is this impacting the state's system, and how can we clear up any confusion with people who decide to go either route to get their vaccine?
Okay, Secretary Crouch, it's got to be you, sir.
Yes, sir. Thank you, Governor. Good question. Because the federal government is pushing vaccine directly to some providers, to pharmacies, to federally health qualified clinics, there is a little bit of a disconnect with regard to who to call for the public. And we apologize for that. That's unavoidable at this point. We want you to get your vaccination anywhere you can get your vaccination as quickly as you can get that shot. So you can call any of those. The federal government is really pivoting towards more of an immunization program that follows the model of the flu vaccine, where when flu season comes around, you go either to your private physician, you go to your local pharmacist, or you may go to a clinic somewhere if you're a patient at a clinic. So what you're seeing and what we're experiencing, which is not trouble-free, but is a transition to that normal vaccination effort, immunization effort that CDC and the federal government always uses. The difference in what's happened now is that we're in the middle of a pandemic, and the numbers are so much greater than those who get routine vaccinations for influenza, et cetera. So the government had to do some special efforts here to get this out. The GATF, the governors set that GATF up months ago in January. That has done an absolutely unbelievable job of getting this vaccine throughout the state. And if you remember, with the different types of vaccines and the different rules with regard to administration, very complicated process. So I hope that helps. Again, we're pivoting to more of a routine immunization program in the state and across the country. Thank you.
All right, thank you, Haley. Next to Tim Cook with the Spirit of Jefferson.
Yes, thank you, everyone. Good morning. Hopefully this question isn't redundant to what has already been asked. Jefferson County officials are reporting again that they're still having significant problems with the Everbridge registration system. Berkeley County Health Department has reverted to another system to collect names and information from local residents, the WVU medicine system. Because of a problem of getting accurate current data, the health officials up here are worried about being able to distribute all the vaccines, the increased vaccines that they're receiving. What advice do you have for local health officials and I guess to local residents? I guess that question was already asked, but do you see a time frame when the problems with the redundant or outdated information can be addressed?
Okay, I think Secretary Crouch, you've got to answer this, but I would just say to all those folks up there, we don't want to lose focus with all the good that's going on, but we absolutely can always do better, and we're going to continue to try. I'll promise you that I'm going to push everybody to continue to try to assist and help any and every way we can, and I think that Jefferson is the only red county right now that we've got. Is that correct? And everything. And so we got a problem there. We're going to continue to try to run to the fire. And Secretary Crouch, you can answer the stuff about Everbridge a lot better than I can.
Yes, sir, Governor. Again, the issue with Everbridge is that there were a lot of folks using that list. And again, we're getting 70,000+ shots a week in arms. So we did use Everbridge to provide a lot of vaccination appointments for folks. It's as we move towards this more logical approach of community providers doing the vaccination, such as physicians, clinics, et cetera, that we started having more issues here. We're clearing that list off, as I mentioned earlier. The local health departments contacted those 80 years old. We contacted the African-American population, 65 and over. We're doing 70 and over this week. That list is going to be cleared out completely. We will then look at it. The governor's already directed us to look at a better way to assist folks in getting appointments for their vaccinations. So we're looking at that as well and how we can pivot to that in the future. So again, we're clearing the list. We're going to make sure all of those people get vaccinated. Thank you.
All right, thank you, Tim. Next to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Over the weekend, of course, we had a notification that a state legislator has tested positive for COVID. And as was discussed at a briefing with legislative Democrats this morning, there was an indication that he attended a dinner gathering that there was some concern could be a super spreader event. Given the governor's previous inquiries regarding laxity of enforcement of mask wearing and other COVID protocols, has there been any contact with the legislative leadership concerning this potential outbreak?
Well, Phil, I've got 2 or 3 things. First of all, I don't know of anything that happened, with the Democrat caucus today and everything. And I know too that I have, I have constantly preached the same sermon. I don't think we can run in and arrest people and haul them out for not wearing a mask or whatever, but it is the wrong thing to do. From the standpoint of of this man that you're referring to. I coached him in Little League Baseball. And so I know him really well, you know, from time to time. I think Brandon gets extreme in his views, and I hope and pray in every way that he gets well and gets well soon. You know, when we do things, whether they be dinner gatherings or whatever it may be, and we basically ignore the concerns and everything, we ask for it, don't we? And that's just all there is to it. Now, and so, you know, there's additional testing that's being offered this week to the legislatures, and I hope and pray they'll take us up on this, and we need to constantly continue to follow protocols and do the right things. I have not relaxed the mask requirement, but you got a lot of stubborn people from time to time. I mean, that's just all there is to it. And sometimes, you know, the most stubborn get bit. And it's just really unfortunate. And all I'm going to say is, you know, to Brandon and his family, you know, Brandon was a buddy with my son Jay, and we're just going to hope and pray that he gets well and gets well really soon. But Phil, while I got you, I want to clean up one other thing, and I want to just ask you just this: is you've written multiple times about Bubba Watson's house, you know, and I just want to just tell you just how I can't understand how you can write stuff that is so inaccurate, distort stuff, and everything else. Now, just stay with me just 1 second. The Charleston Gazette, way back when, you know, when Zuckerman was here and everything, they wrote a lot of stuff bad about old white charities. Probably were one of the contributors, if not the contributor, to starting a federal investigation. A federal investigation that cost us an incredible amount of money. It absolutely took time beyond belief, and it was anxiety out whatever. It was really, really tough on my family, and it was tough on all the people around us. Throughout all the investigation, after looking at every business, every transaction, everything under the sun, what was found? Nothing. Nothing. Out of going through everything we have, and costing us all kinds of money, all kinds of time, and all kinds of anxiety, we found nothing. The Charleston Gazette basically promoted the idea that maybe, just maybe, we weren't handling the old white charities money the right way. And all through the investigation, what they found is just this. I had put in myself, personally, I had put in $131 million. $131 million so the state of West Virginia could have a FedEx golf tournament, something that never has happened ever in West Virginia. Now, through the investigation and all the stuff, and at the end of the day, we lost the golf tournament, didn't we? We absolutely found nothing that, as far as any wrongdoing that the Justice family had done. We lost the golf tournament. And again, the Charleston Gazette did a great job in just tearing West Virginia down. Now what you're doing with Bubba Watson's house, you've written about it several times, and just this, here's the real truth, Brother Phil, and that is you indicate that the Justice family owns a house and bought the house and this and that and everything, and went out and bought a $2.5 million house and and it's just a lie. It's just more exposure that your paper has become an Inquirer magazine. That's all. It's not, and it is supposedly the state newspaper. And on top of that, here's the real straight stuff. Bubba Watson is a professional golfer and a really good guy and a really good friend of ours. Bubba Watson knew that we're not going to have our tournament here. And so the brass tacks facts are the same with Keegan Bradley and others. They decided, why in the world do I have a house there? I really have a house there so I can come and play the course and familiarize myself with it and maybe make a living. Make a living. That's what they do. They go tournament to tournament and make a living. So he asked us personally if we would buy the house back from him. And we went to Premier Bank, borrowed the money, bought the house back from Bubba at $2.5 million, turned right around, put the house back on the market, and sold the house to, I think, a doctor from somewhere in southern West Virginia. Now, in all of that, Phil, my family, I don't think has ever been to the house. I know I haven't. But you write about it, Phil. You write garbage. That's all there is to it. And it's a crying shame. So with all this, those are my answers. My answers are, we ought to be wearing masks here. You ought to quit writing the garbage and be, you're supposed to write the news and have facts. If you write garbage, you're the Inquirer magazine.
All right, Governor, I'll turn it back to you to close out.
Well, today, I want to tell you just this. Today, at 4 o'clock today, we're going to have a roundtable with many, many, many of our businesses all across our state and everything that represent everybody from our professionals, whether they be engineers or accountants and lawyers, or they be our small businesses, from just everything in every way at 4 o'clock. And we're going to do it, and you'll be able to live stream every bit of it and everything from the standpoint, and it'll all be about personal income tax. I really encourage each and every one of you West Virginians to watch it, and watch it really, really closely. Because one thing I think, if you get there and you understand, you truly understand, you're going to stumble upon just this question. A question that was asked, from a legislature to other legislatures. And he asked that question to them, what if the governor's right? What if the governor is telling us the straight truth? And what if the governor is right about what he's proposing? I think if you get the facts, you will come upon one decision. The governor is right. The governor is absolutely right. This is our time. It will put more money in your pocket, substantially more money. It will absolutely make our businesses go like crazy in West Virginia because of one thing, and that's the only thing I would tell you in this briefing today. It is just that. If you and every other wage earner in West Virginia has significantly more money, you will spend it in West Virginia. That in itself will drive our businesses to prosperity like you can't imagine, without one single additional person moving to West Virginia. Can you imagine? Can you imagine that truly the real numbers are this? Every single household in West Virginia, there's 732,585. 732,585. Every household in West Virginia, as an average, I'm saying it again, I don't want you to misquote me, as an average, some of the households will get $350. Some of the households will get $2,900. But as an average, 732,585 households will have an additional $1,483. Now you think about it. You just go out and drive around and look everywhere around you and think, if all those people had additional dollars of that much money beyond their paychecks today, what are they going to do with it? They're going to spend it. Are the television stations going to have more advertising? Of course they are. Absolutely, they're going to spend it. Think of the dress store downtown. When you drive around, just think of one thing for me. Just please do this. Think of the dress store downtown. Small business. Small business is the backbone of all of our state. Do you really believe, if you look around all those places, all the apartments everywhere, as an average, all across every one of them, $1,483 a piece, are we going to sell more dresses or not? Don't believe the garbage somebody feeds you. We have set this thing up and modeled it beyond belief to where every last one of you is going to have cash positive money after you pay a little more in sales tax, or if you smoke, you buy more cigarettes, or you drink, you buy more liquor, or you don't do that and you buy more soft drinks. Every last one of you, by all the modeling that my people can possibly do, will end up with more money. And our small businesses, my gracious sakes of living, it is 180 degrees from what the Chamber of Commerce is trying to tell people. 180 degrees. They are so wrong, it is unbelievable, because over here is the light, not over here. Thank you a bunch. 4 o'clock today. Y'all listen up. You'll see a lot of faces that you're really familiar with, because the leaders of West Virginia are trying to stand up and tell you the real truth. Thanks so much.